something that's made a lot of headlines in the last couple of weeks, beyond obviously the COVID-19 spread reaching pandemic levels and the public health response in the US. One of the biggest stories in the US in relation to the disease has been the testing and public diagnoses of professional athletes that are very well known, household names, the Brooklyn Nets, I think Utah Jazz, Los Angeles Lakers off the top of my head in the past week have all sort of made headlines of, one, both testing all of their players, and two, confirming some asymptomatic diagnoses on the team. We talked just before about, some slight expressed concern that this being some of our population's first exposure and understanding of the disease may stunt their perception of how exactly COVID-19 could affect an individual. Could you share a little bit of your perspective on exactly what it means in relation to an athlete's health to have it, and how exactly we should be perceiving this news as we get it?
Yeah, I think you're exactly right. There's a number of reasons why we're seeing in the headlines about athletes having COVID-19. One of them is certainly their availability of testing and the fact that they're testing asymptomatic individuals, which is really not what has been taking place so far in the general public, and that's primarily related to the fact that we have limited tests. Another reason is because these individuals are often in very, very close proximity with each other. So they're, both traveling very closely together and then playing where there's bodily contact. And, if one player gets it, there's a reasonable likelihood, because this is droplet spread, that other players on the team may well get it and be exposed. So I think there's a number of reasons why we're seeing these athletes having the disease. Now the question is, what effect does it have on athletes compared to the rest of the population? Certainly, we're still learning a huge amount about COVID in every population. The interesting thing is when it's in different groups, we're seeing it having different effects in different parts of the world. We all know that it seems to be much more deadly in patients who have significant comorbidities or are elderly. But does that mean that young athletes are safe and it's not going to have any effect on them? I think the answer to that is probably no, and that we need to take this very serious for our young athletes. One of the things that is getting all the highlights is the mortality rate, right? But what we're not thinking about also is the morbidity. And so we're certainly concerned that there may be significant limitations long-term for those people who get COVID, and whether this is actually affecting their lung capacity. And obviously this will be important for young athletes. I think we need to be very vigilant. I think we need to recommend to our athletes to follow the exact same recommendations that we're giving to the rest of the population. They need to wash their hands regularly, maintain social distancing. And obviously this is something that can be more difficult in athletes when they're used to training with each other, or they're playing games where there's bodily contact. And so they really need to pay attention to that and avoid bodily contact in sports and maintaining that social distance.
I think it comes back to the point that if you're going to take anything away from the fact that these guys can get it, is that anyone can get it. If you're a Donovan Mitchell fan, a Kevin Durant fan, this says nothing to the status of your health and well-being and the capability of overcoming this. It speaks to the fact that it is that random. It can happen to very much so anyone. And you got to be cognizant of the symptoms and following public health direction in the meantime. So thank you so much for touching on that. I know that's it's a very interesting aspect, I think, of the development of discussion we've had related to this pandemic. Is there anything else you want to add relative to COVID-19 right now?
So I think one of the things, what we are seeing is that COVID-19 in a small subset of the population can have very detrimental effects on the heart. And so we are seeing very significant cardiomyopathies in some individuals. And so what we're going to have to learn is how prolonged those episodes are. Does the heart recover quickly? And for young athletes who develop it, how are we going to guide them in terms of exercise if they do develop COVID-19 with some myocarditis. And so there's a lot that we still need to learn here. And again, I think the important point is to apply the same rules for athletes that we apply to the general population: hand washing, social distancing.
And Doc, maybe if you could also speak to something else that I've noticed a lot on social media lately is with the quarantine, a lot of people have the itch to move right now. They want to get out. It's springtime. A lot of people pining to go for a run, a hike, some kind of exercise in some kind of way. Can you make, from your expert perspective, any kind of advisory on as to what people should be doing to, safely ensure they're getting their exercise and keeping up with their cardiovascular health that way?
So I think irrespective of what disease we're talking about, being fit and active reduces your overall risk. And if you look at the flu, for example, for people who are fit and healthy, the effects of the flu are less. And so we certainly want to encourage people to remain fit and active. If you're outdoors and you're maintaining social distance, really the risk is very minimal. So I think going for walks where you're not going indoors and you're not kind of walking in groups or running in groups, you're doing it in isolation, I think the risk would be minimal. There is another message though, I think that is that patients who have symptoms really should limit their exercise. We know that if you do have the flu or if you've got any other viral illness, we really recommend not exercising during that period of time because there is a risk with doing that. So I would suggest to people if they become COVID positive or symptoms suggestive of it, that they recover completely before they do any vigorous exercise.
That's excellent advice. And, if we talk about diet and exercise being a third of overall health, it's good to hear that we have some messages for how we can manage that still during this. So a little certainty during a very uncertain time. Doc, thank you so much for your time with us today. I really appreciate it.
Not at all. Pleasure. Thanks, Kevin.